Hello, my name is Patricia Elliott and I'm the director of the Hood River County Health Department. Historically, the health department has included both public health and environmental health, but as of July 2025, Prevention and Veteran Services Office officially became divisions of the health department. This adventure began in earnest with planning sessions beginning in early fall of 2024. Innumerable man hours, pre-planning, list making, hashing out details, revisions, construction, and room renovations went into this process. In May of 2025, the Prevention Division physically moved into the 1109 June Street Health Department building. The courthouse office, vacated by the Prevention Office, was then given a coat of paint, and then the Veterans Office moved out of their rented space and into the courthouse. This makes it sound easy, but it was a lot of work. We're still working on smoothing some processes over. Things are pretty smooth, but we still have a ways to go to optimize all of our work. It hasn't yet been a year, but we have come up with a lot of efficiencies and eliminated multiple redundant systems, are leveraging staff efficiencies and working closely to support all of the programs. At the health department, our work focuses on creating healthy communities and on key populations and ensuring equitable access to health services. This effort is made possible through long-standing partnerships with several local and regional partners. Partnering allows for our services to complement one another and together design creative solutions to local health concerns. We participate with Columbia Gorge Health Council and many other organizations to complete the community health assessment and community health improvement plan on a regular basis. Additionally, we have representation and a vote in the clinical advisory panel and the Community Advisory Council to help advise regional coordinated care organization. Over the last year, we've continued to seek ways to bring new clients into the building and to create new revenue sources. We've completed extended hours clinics 3 times this year as a direct input from a client satisfaction survey that was overwhelmingly positive about the services we offer, but found our hours to be limiting. We were able to secure a private foundation grant to allow us to expand our hours on a semi-regular basis. Shared outreach efforts, for instance, like during the Hood River County Fair, amongst all divisions of the health department, and cross-training of employees in programs like tobacco cessation across divisions has been a successful way to streamline work across our newly merged divisions. The health department leadership team has representation from all divisions. Community partners such as dental providers and vision services brings many residents into the health department building for the first time. This allows us to let people know what services we have available as a department. Collaborating with other agencies and county offices allows us to support other programs and departments. The health department was heavily involved in the ambulance service plan coordination over the past couple of years and will have an ongoing role in that oversight committee. Medicaid reimbursement rate reduction due to contractual changes. It went into effect May 1st. And although we may not see a full 30% decrease in our revenues because some of the billing codes have actually increased their fees. Demand for clinical services has decreased over the years for a variety of reasons. There's more people insured, more people have primary care homes, and less need for safety net services. We are staffed very leanly. We are down 3.8 full-time equivalents across our division. These are all unfilled positions that were previously had a person in them. As you can see on the slide, we are down 3.8 full-time equivalents department-wide in the health department. We're down 1.8 FTE of public health nurse. We are down 1 FTE prevention specialist, and we're down 1 FTE bilingual administrative support specialist. These were previously filled positions that are that we have not filled because of budget constraints in the past. With our current vacancies, we're at risk of not being able to adequately respond to an emergent disease or communicable disease outbreak. It's critical that we maintain a specific level of staffing to manage outbreaks, reporting, and follow-ups required for public health risks. Likewise, the prevention division is supported by several grants with specific deliverables by prevention specialists. The workload is unmanageable with current staffing level, including with health department staff assistants. Our proposed fiscal year 27 budget includes 1 FTE public health nurse to cover infection prevention and control, disease intervention specialist, and some general clinic duties. This position is a replacement of 1 FTE of the 1.8 FTE combined RN positions left vacant in fiscal year 25-26, as well as a 1 FTE prevention specialist. Some of the items that we have not addressed due to fiscal constraints include succession planning. Within the next couple of years, we have several leadership staff who are eligible to retire. Lack of succession planning risks stability, continuity of operations, and institutional knowledge. We would love to implement a proper electronic medical record system. We are severely behind the times in terms of electronic medical record performance and tracking capabilities. In addition to cost constraints for the electronic medical record platform itself, we're lacking staff time to implement a transition. A new electronic medical record would greatly improve our workflow, efficiency, and care coordination. Another issue that we have is website inadequacies. ADA accessibility is going to be required to be fulfilled by 2028 for websites. And right now, our staff have an inability to make changes to our current website without significant assistance. Building upgrades. Much has been done to our building in the last number of years, thanks to special reproductive health grant provided by the federal and government and state government that allowed us to do some major work on our building, such as a new roof, new gutters, painting interior and exterior, new water heaters, reconfiguring offices to accommodate the merge with the prevention division, bathroom rebuilds due to just needing a lot of repair. We would love to have a space big enough for all of our staff to be able to comfortably meet. And that would be wonderful to have a conference space big enough. Another issue with our current building is our sidewalks and parking lot are not ADA compliant, and it's a very, very expensive undertaking, which we won't be doing anytime soon unless we get more special revenue funding for that. Great news. The health department has learned that we'll be receiving some rural health transformation program carve-out funding specifically for public health programs to expand home visiting for pregnant women and children up to the age of 5, and that meet specific broad risk levels, and for families with children with identified health conditions up to the age of 21. We'll also be supporting women who are breastfeeding, and also planning to engage in some regional coordination and collaboration as part of this project. These are brand new funds and are not yet budgeted. So, thank you.